Okay, members, so we do have a quorum. I'm going to call the meeting open, and the meeting is now open to the public online. I'd like to welcome all of our members who are participating today by video conferencing, and I would like to thank members for cutting short their time to attend this meeting today in the current circumstances. I would like to remind members about the protocols regarding the use of electronic devices. There is one apology that I have, members, today, which is from Arlea Flynn, and Arlea has assigned her vote to me today, should that be required. Are members aware of any other apologies? No, thank you. Okay, so members, we're moving straight then to our briefing today, which is a briefing from the Minister of Health on COVID-19. The Chief Medical Officer and the Chief Scientific Advisor will also be here to provide an update. Am I correct that they're online, Keith?
I can see Professor Young's on. I can't see Dr. McBride yet, but they're certainly due on the call.
Okay, so we'll proceed there, and hopefully Professor McBride will join us as we go. So I remind members that this is a one-item agenda today with a focus on COVID, given the circumstances. If members go off topic in relation to that, I'll leave that up to the Minister as to whether he answers or provides maybe a written response, because we're very conscious of time today, and I'm sure that there's a lot of issues COVID related that members do want to pick up on. So I'd now like to welcome by Starley Health. Minister, can you hear us okay? Hi, can you hear me okay, Minister?
Yes, I can hear you, Chair, yeah.
Okay, there seems to be a further delay on your line, but hopefully I think that looks better now. Also, Professor Ian Young, can you hear us there, Chief Scientific Officer Young? Can you hear me okay?
Yes, I can. Can you hear me?
Yeah, I'm hearing you there fine. And we'll bring Michael in then. The Chief Medical Officer is not just online now, but if you're content, Minister, I'll go back to yourself if you want to do some opening remarks, and then we can pick up on any of the other issues then, and question answers following that.
Certainly, Chair. Just to keep I'll keep these brief, just to get an engagement with members. And again, Chair, I hope you and your committee members have had an enjoyable Christmas and a new year. And as ever, can I thank you for the opportunity to update the committee. As I said, I'll keep my opening remarks short to allow more times for questions. But since the last brief we have had the emergence of the Omicron variant, and as we know, Omicron is presenting us with an increased level of challenge in terms of its level of transmissibility and the levels of infection within the community. When in October last year I published my statement on winter preparedness, it was published alongside Trust's winter plans, and I said that the health and social care sector was likely facing its most difficult winter ever, and that is still the case, but with the Omicron wave, our task has just got that much more challenging. Importantly, all of the activity, the preparations, and the regional coordination that was outlined on the 22nd of October is still relevant. One of the key messages was the need to remain flexible and adaptable, and that is more important now than ever. It was on the 14th of December then I hosted a high-level meeting with a range of key stakeholders. That included trade unions, the Royal Colleges, our professional bodies, and senior healthcare officials. And the purpose of that meeting was to share our current plans for managing the forthcoming surge and to seek input from those stakeholders, actually from across the entirety of our health and social care system and the wider health family. So with the Omicron wave likely to impact severely both in terms of health service pressures and in terms of depleting health and social care staffing capacity further, trusts will continue to try to maintain high priority elective care. However, if unscheduled pressures intensify, they can scale back to redeploy resources as we've done previously. We'll also continue to manage unscheduled pressures, critical care, and respiratory care actually on a regional basis. And that will maximise our capacity right across Northern Ireland and help to smooth pressures if that's required. As members may be aware, as of today, there are 404 COVID positive patients in our hospitals. That's an increase of 48% on the number just before Christmas. So to date, we haven't seen a material increase in critical care pressures, while there's currently an additional 30 COVID positive patients within intensive care. So it is important to stress that our health and social care service will continue to be there for us all this winter. It'll be stretched like never before and may have to prioritise patients based on clinical need, but the health service will assess and treat those who really need it. So from yesterday, people in Northern Ireland who get a positive lateral flow test will no longer need a PCR test to confirm that result. If their lateral flow is positive, they should assume they have COVID-19 and they are infectious, and they should therefore self-isolate immediately for the required period. They no longer need to take a confirmatory PCR test, and that's a temporary step that we've put in. The removal of the requirement for a confirmatory PCR testing, as I say, is a temporary measure in response to the very high prevalence of COVID-19 in Northern Ireland at present. And when prevalence of COVID is high, a positive lateral flow test is a reliable indicator of COVID-19 infection. So removing the need for the confirmatory PCR test will help free up PCR capacity. It ensures that PCR tests are focused where they will give most public health and clinical benefit given the current high levels of disease. And that includes maintaining PCR testing for those who are clinically vulnerable, allowing new COVID-19 treatments to be deployed in the event of a positive test. And I would really underline the importance of people actually reporting the results of their lateral flow tests, positive or negative, because that allows contact tracing to be initiated, but also helps us to monitor the progression of the pandemic. Chair, as you're aware, our vaccination programme has been very successful since it was first launched back in December 2020, with over 3.5 million doses administered in Northern Ireland to date. However, the rising tide of COVID-19 cases underlies the urgent need for more people to take up the offer of vaccination. So actually, when compared to fully vaccinated individuals who have also received their booster or third dose, unvaccinated individuals aged 50 and over are almost 30 times as likely to be admitted to hospital with COVID-19. So the risk of getting infected with COVID is considerably higher than at any previous time in the pandemic. So faced with this very real threat, we have been encouraging people who are eligible to get their booster dose as soon as possible, as that is the single most important step that an individual can take. And that will give an individual vital protection, particularly from getting seriously ill from the virus. So boosters, as well as first and second doses, are readily available from health trust vaccination centres, from participating pharmacies and GPs. It has never been easier to get vaccinated, with plenty of available appointments to book or actually to walk in. We'll continue to make every effort to encourage those who remain unvaccinated or those who have yet to take up the offer of the booster dose to come forward as quickly as possible. So, Chair, I'll finish my remarks with a reminder that, again, everyone can play an important part in protecting ourselves, those we care for, and our essential health services, which are under unrelenting pressure. Each of us can make a difference by making the right choices, by limiting our contacts, prioritising those people who mean most to us, and take all the precautions we can before we meet. So get vaccinated, be that a first, second or booster dose, take a lateral flow test, wear a face mask, and be aware of good hand hygiene and observe guidance and regulations regarding social distancing. So, Chair, thank you, and I'm now happy to take members' questions.
Okay, thank you, Minister. I suppose the first question from me is around the whole issue of workforce and the pressures that workforce continue to experience over what's been now a long period of time. And we know, given the figures as they are, and given remarks by Professor Young, that we are facing into the likelihood of increased pressures across the health service, all elements of it. And as at the start of December, Minister, you had indicated in relation to the workforce appeal, and I have raised this with other department officials as well, including with the finance, the last time we had a budget briefing. That workforce appeal drew in 51,234 expressions of interest, out of which there were 30,489 formal applications received and 4,936 new appointments made. That leaves, Minister, 25,563 applications from people who have indicated a willingness to help out within health and social care, I presume. What update can you give us in terms of how many of those are coming through the system? How many of those can be got into service to take some of the pressure off the healthcare staff, which has been unrelenting over such a long time?
Chair, just on those points, actually an update on that workforce appeal is 5,261 new appointments have been made across health and social care, and that's both at health and social care, admin and support appointments as well. The workforce appeal also recently undertook to recruit staff for elective care services, specifically, and expressions of interest generated another 940 applications. Of the number of, I suppose, those who weren't successful that you indicated, a large number actually, after having submitted, either withdrew, declined an appointment, or ceased to communicate with the workforce appeal staff, or were actually rejected from the appeal for not being suitable. So candidates may not have been suitable for a number of posts, or actually where they were applying to, but that workforce appeal goes on. Our chief social worker has actually just issued a very targeted one through NISC for social workers to come forward, even should that be for short-term pieces of work. Should it be for completing a single assessment or covering a shift in a children's care home, or those points as well. So that has received another 940 applications as well. So that work's ongoing. Unfortunately, the high numbers of applicants haven't always successfully transferred into people coming forward and taking up posts, either because of unsuitability. But in regards to those 5,261 that have come, they have been a benefit to the workforce and the support that's been there.
And given the so there's a range of issues there which you've outlined, potentially some of which, if no communication or whatever. How many live active applications are still in the system out of that now? What would be still over 25,000?
I don't know out of that 25,000 that haven't followed through, but as I said, the figure that I have to hand, Chair, is the 5,261 new appointments that's been made from that original appeal, and that was from the workforce appeal. Also, there was another appeal then for vaccinators, which was launched in December, actually 2021, so just at the end of last year, and 2,319 expressions of interest have come forward through that as well. So that's generated over 1,100 new formal applications for Band 5 and Band 4 vaccinators. So there are a number of workforce appeals where people may have been applying to maybe 2 or 3 of them, and it's where that most suits them, and where there's also that vacancy to use their skill set that we've brought them forward.
And when you say some of the skills, not suitable skills, is it not right to say that even within nursing, for example, currently nurses are experiencing a very high volume of work, which is at times non-core nursing related. So it could be portering at times, we've heard, or filing. The other key issue, and one that I'm also hugely concerned around, is, say, ambulance staff. So are there people with, for example, driving skills who may not be qualified ambulance staff, but who could support ambulance staff or provide some cover? Is there potential scope within any of the schemes to provide assistance in that regard?
In regards to ambulance staff, and I'll need to refer to NIAS, I'm not sure if even Michael could pick up on this, but in regards to our ambulances, when they go out, we send out two trained paramedics or 2 trained officials within each ambulance, rather than having what would be a non-skilled driver with a skilled professional beside them, because that wouldn't really cover the needs that we're actually doing in regards to ambulance service as well. I don't have the detail of that specific ask in the workforce appeal, Chair, but I can follow up on it for you.
Could you provide us with more information as to how many have been either withdrawn from that process or being rejected from those applications, so we can get an idea?
Yeah, Chair, I can do that in regards to, because as I've indicated, people come forward with goodwill and expression of interest, as to actually joining the workforce appeal. But when it goes down through the formal process, then we are seeing that level of really attrition, either people not coming forward or completing the programme of service. So we'll get a further breakdown specifically on that for you.
Okay. Then, leading on from that, and I have already mentioned the ambulance service minister, I would be gravely concerned and picking up on concerns from all over the country in relation to ambulance call-outs. And I know that Michael Bloomfield has addressed this directly and has acknowledged that there are times when they're in a position of having to say to people, listen, you make your way to hospital yourself as quickly as you can. What's being done to address that situation, to try to stabilise that, particularly in rural communities? There's a huge amount of concern now that ambulance service, when needed, may not be available.
Well, Chair, I think it was Ian, thankful for Michael and the commentary he has been given in regards to the strains that has been on our ambulance services. I think actually his indication yesterday is something that's impacting us across health and social care is actually the large number of absences that we're seeing, both because of COVID and non-COVID related services as well. NIAS yesterday were, I think, or not, the 4th of January, were about 25% absence rate. Nearly 15% of that was due to COVID, but that's because of the nature of their front-facing work as well. So it does put on the additional stresses as well. In regards to the additional work that we're doing with NIAS, come back again to the surge plans that NIAS actually put in place in regards to the trust response that were published last October. They do look, and we are operating now, which is a smoothing system where we're sending ambulances to the EDs that'll get patients discharged as quickly as possible and get the ambulance back actually out on the road to the next call as well. So I want to pay tribute to NIAS and the staff that we are still seeing coming to the front line, but also the support that we're seeing from other vulnerable community ambulances service, but also some of the private sector that we've had to bring in as well to make sure there is additional cover there while we currently need it.
Okay, and the final one from me then before I go on to members is around surgeries. And I know there's been figures quoted recently of 162 red flag or suspected red flag surgeries cancelled there recently. What's your assessment of the impact over the next period of time in terms of surgeries, and what is being done to protect those, to try to ensure those surgeries can take place, and what has emerged from your meeting that you referred to of key stakeholders? And I welcome that you have met those key stakeholders. That's something that I think was something that was indicated. What has emerged from that in terms of planning that can provide additional hope in relation to those very important surgeries?
Well, in regards to the specific of the elective care, we've tried to keep our scheduled elective care going as much as possible in regards to what is being done. So look, even in the week before Christmas, I think there was 5,500 scheduled elective procedures actually took place. In regards to the number of, I think it was red flags you referred to that were postponed, there was 126. I think that was actually over a 4-week period. Now, a number of those will have already been taken place or rescheduled as quickly as possible, because that's what we envisage Trust doing, and they do that. In regards to that greater pressure, we're still working again at that regional level for a regional prioritization operational group, where they're looking at those high case priorities and getting them to a theatre as soon as is practicable and as possible. So there's still a large focus on getting as much of that elective work kept to the fore as well, and that's again the stresses that we see putting the pressure in regards to staff being available. The outcome, I suppose, of the meeting really was we gave a number of presentations to all those involved, and it was about bringing people together and really talking through where we currently are, but what the surge plans that were being produced by trusts would actually mean should we have to step up different levels at different points in time. So it was beneficial. I think we had everyone in there, or a wide scale there, from, as I say, from our trade unions, from our royal colleges, community pharmacy, primary care. So, and I think it also provided, Chair, a sense of understanding of the pressures on all systems across the health service, that if one bit becomes pressurised, it has a knock-on effect elsewhere as well. So it was an understanding, really, that we were all part of this as a wider health and social care family.
Okay, thank you. I'll go then. So I have at this point in time, I have then Deputy Chair Pam Cameron, then I have Carol, then Deborah, Colin, Paula and Jerry. That's the order I have in front of me there at the minute. So go back to yourself, Pam. Do you want to go ahead, please?
Thank you, Chair, and Happy New Year to you and to the Minister and to CSA and CMO. Good to see you all. And I hope 2022 is a much better year for all of us, and hopefully we see less severe restrictions, I hope, and less severe illness and death in this incoming year. I suppose I want to ask some questions in around face coverings, but before that, could I maybe just ask quickly if either Ian or Michael want to give us an update on what, on maybe a readout on where we are in terms of what we know about Omicron and the severity of it and the impact that may have going forward. And I wanted to ask for an update on the lateral flow tests, supply in particular, given the difficulties there have been, in particular with pharmacy, in receiving appropriate quantities of those lateral flow tests, which are obviously in incredibly high demand, and that's going to continue, if not get much worse, given the change now moving away from PCRs, albeit on a temporary basis. And also, maybe, Minister, if you wanted to tell us, what impact there will be on contact tracing, given the move away from using the PCR testing and really relying on people reporting their lateral flow tests. But I had kind of specific questions around face coverings, because I've been contacted by a number of constituents who are incredibly worried about the proposal to remove the exemption from wearing a face covering for those for whom it causes severe stress. And one of my constituents is a lady who, as a teenager, was a victim in a robbery by a masked man, and years later suffered horrific domestic abuse. And she's really unable to bring herself to wear a face covering because of the trauma that these incidents have caused. In fact, trauma is actually caused even in her place of work when she's approached by particularly men wearing face coverings, and that gives her desperate stress. So I wanted to ask, Minister, if you are going to review the decision to remove the severe stress exemption. And I wanted to also ask whether there was an equality impact assessment carried out prior to the decision to place the onus on an individual for proving an exemption for face coverings. And finally, and I'm sorry that I'm asking so many questions, but I have to take the opportunity. But in the scenario that an individual who has an exemption, but without evidence on them at the time of being fined for not wearing a face covering, what steps will they need to take to appeal that fine? And obviously I'm aware that the decision has now been taken to postpone enforcement from tomorrow, but given that this is still on the books, as it were, and may well come in the near future, would appreciate updates on all of those issues. Thank you.
Thanks, Pam. I'll pick up on a couple of those before handing over to Michael and Ian in regards to Omicron. In regards to face coverings, when the proposal came from the Executive COVID Task Force in regards to the changes that were to be made about the enforcement of face coverings, we have a department have engaged, Health and Social Care Board and PHA have engaged with what can be done and what should be done in regards to those. So that work still continues. It's been led by the Executive COVID Task Force. It's not wasn't actually one of our proposals. It came from an ACT paper towards the end of December about the enforcement regulations as well. So we are contributing to the ongoing conversation that's been had at the executive. It was raised today again, just in regards to how people can actually prove that exception and what it actually means in the appeal mechanism that may be forward. So that's why it has been postponed again in regards to that enforcement of it. It will stress that the wearing of face coverings is still covered in certain areas by regulations, but it's the ability or the exemption certification that has been the one that is causing distress as well. And we've also, I did ask the Executive COVID Task Force as well to put out communication today as well as in regards to people seeking that exemption certification from their GPs. That's not currently in place and not something that we have established because we're aware now that GPs are being asked to provide that certification, but it's also leading to their staff receiving abuse as well, because it's not something that we currently have in place or envisage. So that work's ongoing at an executive level, as I say, led by the Executive COVID Task Force. In regards to lateral flow devices, there has been actually extensive deliveries across the system in Northern Ireland to community pharmacy and to a number of other outlets as well. One of the things we actually did over Christmas and the New Year was actually BSO set up collection points where community pharmacies that wanted them could actually come and collect more if that was necessary. And I think out of the entire sphere, 180 community pharmacies actually availed of that service as well. So I think we're receiving in the region of over 1 million per delivery of LFTs coming in each time as well. So it's not about there not being sufficient stock. I think it's people coming forward and maybe I'm reluctant to say this, but maybe panic taking the numbers that there, because there is a narrative that there is a short supply, so they're maybe taking more just to have that comfort stock. I'd ask people to take what they need at this minute in time, because I can assure you that we have enough in country. Our community pharmacy are working as a central distribution point for those to be able to pick up as well. So it's about how we just manage what has been a high demand for those devices. What I will say as well, and I think it goes back to your point, but also the one I raised earlier, I would encourage everyone to record their lateral flow result, be that positive or negative, because it does help us track where the current rate of infections actually are in regards to not just high levels of positive cases, but also where there are people who are taking negative tests as well. So in regards to Omicron, in regards to specifically what we know about it now, I suppose I'll hand over to Ian initially and then maybe Michael.
So thank you. In terms of Omicron, we know first of all that it's much more transmissible than Delta. And secondly, that the effective severity of illness after Omicron is less compared with Delta, particularly in those who have received a booster of the existing vaccines. The consequences of that, I think, are twofold. Firstly, that we're seeing a much steeper rise in case numbers and much more rapid transmission in the community than we did at any previous stage of the epidemic. Members will be aware of the very high numbers, and case numbers, in fact, are no longer a reliable indicator of progression of the epidemic in the community, because we've reached a ceiling really in terms of our capacity to detect cases, as has the rest of the UK and the Republic of Ireland. The modelling suggested that we would probably end up with in the order of 25,000 cases or so per day of the virus at peak. And, that's more than the tests which are available to us in terms of PCR. So, what happens to case numbers in the next week or two needs to be interpreted in that way. I expect that the number of cases of the virus will peak in the next couple of weeks and then should begin to decline after that. But hospital pressures will not peak until some time later. Because of the success of the vaccination programme, then a smaller proportion of patients will develop severe disease. and will require hospital admission. Increasingly, evidence suggests that the reduction in severity is probably closer to the 50 to 80% reduction than 20 to 50%, but there is still some uncertainty around that. What we're seeing, as Minister Swan indicated, is a significant rise in admission numbers. We're seeing a significant increase in hospital numbers at present. There is early suggestions of a reduced length of stay for patients in keeping with overall less severe illness. And in addition, we're not seeing at the moment significant rises in patients requiring respiratory support or patients in critical care, which may yet be to come, but suggests overall the reduction in severity that I've already referenced. The pressures in our hospitals, as have already been highlighted, will come from two sources. Firstly, the sheer number of patients who may be admitted, and I hope that that will be less than the number of inpatients we observed last January. But again, it remains possible that we could end up with larger numbers, and we all have a role to play in minimising the chance of that. And secondly, it will come from the extent of community transmission of the virus, and hence the number of staff who will need to self-isolate. And that's already been referenced and discussed, so that the capacity of the system to cope with numbers will be reduced compared with the situation as it was last winter. So Michael may wish to add something to that.
No, I think that Chair largely covers it. I mean, there's probably just a couple of quick points to make. I think that the data that Ian reflects there, we're obviously liaising very closely with colleagues across the United Kingdom and the Republic of Ireland in terms of evidence around disease severity, lengths of stay, etc., which is important from the modelling perspective. The likely causes of the reduction in severity are probably twofold. One, due to previous exposure to the virus, and certainly the very important factor around vaccination, particularly getting booster vaccines at this time, but also some intrinsic factors of the virus itself. But I don't think we should be in any doubt that the health service will be under considerable pressure, as Ian said, from the sheer numbers of people who may require hospital care, all within a very short time frame. The fact that this is about 2.5 times more transmissible than Delta, and therefore we are going to see outbreaks in hospitals and outbreaks in care homes. That is inevitable, which will put further pressure on the health service. And then the issue around staff absences. So we've been talking about workforce issues. The critical thing here, the thing which we can all do, we can all make a difference, is by following the public health advice, reducing our contacts, wearing face coverings, and the most important thing of all, those who aren't vaccinated, get their vaccine. It's not too late to get some degree of protection, and also to get the booster vaccine.
Okay, Pam?
Yes, Chair, I do appreciate that, and I suppose the commentary there does really put more pressure on the lateral flow test and that supply. So, I mean, I think we would all be anxious and it's good to know there isn't a shortage of supply, and if it's simply around logistics and getting them from A to B, I mean, it's a good problem, I suppose, Minister, if people are wanting too many lateral flow tests. I think that's what we want. People are following the guides. That's quite clear, and they want to test and to be sure that they're doing the right thing and acting responsibly. So that's a good thing. So I wouldn't want, logistics to get in the way of those tests getting to where they need to be, so people can get them. And we've heard of pharmacies running out within an hour of receiving supply. So I think a bit more concentration maybe on ensuring that we do have the appropriate levels would be very good. I suppose just to come back on the face covering stuff, Minister didn't really answer all those questions, but I can follow those up in writing. But I suppose if you're saying that it hasn't come from health as such, per se, it's come from elsewhere, then I do understand that. But there is great concern out there about how any enforcement will take place. And I think that it's causing more stress to many people, the thought that they may be challenged and fined on that particular issue.
Okay, thank you, Pam. I am going then to Carol. Go ahead, Carol, let it help.
Of the Health Committee and officials. Minister, I think the detail on the meeting that you had with our health and social care senior officials on the 14th of December, I personally would like to know what are the surge plans in terms of winter plans, and if the Omicron variant was factored into those. Even today, we're hearing from health and social care trade unions and staff side representatives talking about the dire situation in our health and social care settings. So I'd like to hear more details on that, because we hear of these plans, but we need to know what they are. We need to know what the detail is. The other question I have is in relation to the care packages. I'm sure you are also well aware in terms of social care, but there are people who are in hospital who need care packages and are refusing to go to a step-down facility or a nursing or care home setting, and their families feel their loved one's recovery would be stunted if they weren't in their own home setting, and particularly for new care packages that are needed, because social care is under huge pressure also. So if I could just ask those questions first of all, please. Minister, we can hear you.
Robin?
Sorry, apologies. We published those surge plans back in October, Carl. I can circulate them again to the committee. There's one for each of the 6 trusts, and it does take into various stages of criticality and what has actually happened and the pressures that each trust is under, and how we can respond then as a region. I can share those again with the committee if that's useful, Chair. They didn't at that point in time take into consideration Omicron, but what they did take into consideration was high levels of COVID and high levels of pressure, and also included in regards should we need more beds or if there was less staff actually available. So they did cover a wide range of different scenarios, but I can share those again with you. They stand as they are because they are fit for purpose. One of the things that they were a surge plan that was meant to cover October, November and December. We've simply extended them into January and probably into February because of the critical nature that we're still seeing we're in. We thought they were simply going to be basically a winter surge plan with COVID in the background, but the steps that are taken in them still stand. In regards to domiciliary and social care, you'll be aware, and I think I mentioned it the last time we were here, we put £23 million into that sector for allowing them to actually increase rates of pay or supports to their staff as well. That has actually steadied the sector somewhat, because we're not seeing the level of handbacks that we were seeing in the early part of December or even late November in regards to those care packages. So it's stabilised the workforce a bit, and we hope to see actually more packages coming forward now once we're actually coming out of the Christmas and New Year holidays, where some of those domiciliary care providers actually start to increase their packages as well. In regards to your further point, and it's one that I know our trusts are actually actively communicating on as well. Once someone is fit to be discharged from hospital, they should leave to whatever appropriate facility is offered initially. I know you used the phrase that was stunted, or their progress may be stunted by going to a step down facility. I would also say their progress could be stunted by remaining in hospital as well, but also by remaining in hospital. And I know the psychological impact, that families and carers have. If they keep them in the hospital, they're going to get the package. That may not be available, but what they're doing is actually taking up a hospital bed as well. So if there is alternatives provided, especially at this time of year when we see the pressures that we're currently seeing, I would encourage everyone to avail of those. And that's what trusts are now communicating with patients actually as they enter the hospital system, rather than just at the point of where they're going to discharge as well.
And Minister, appreciate that, but we've read the winter surge plans from last year, which were very helpfully provided to the committee. But even just from a mathematical point of view, more pressure with less staff doesn't add up. And there are less staff, and our staff are being impacted by Omicron as well, and indeed having to isolate because of infection of the virus at their homes. I unfortunately lost relatives in the mouth of Christmas, and seeing the pressures that both our ambulance service and indeed our hospitals were under. And I have to say, all the hospitals performed to the best of their ability. But I knew looking at the staff that they hadn't had breaks. And even just the fact that they were literally running. Nobody was swinging the leg. They were running from one patient to another. And we're now getting into after March or third year of this virus, and there are less staff, and the staff made a point now, not in a non-professional way, but because I asked them, they have got less staff, and their staff are decreasing on a daily basis. So the meeting on the 14th with, I'm assuming, with the Royal Colleges, I would like to have more detail on that, because they're the experts who their staff are, the people that they represent. And they're the best organisers. They'll be able to tell you what's working, but more so what's not working. So if we could get that, it would be much appreciated.
No, Carl, and Chair able to set up a further update meeting in regards from that event as well, because we are intending to have another follow-up session in February as well. Carl, can I pass on my personal condolences to you and your family as well in regards to having lost someone at the start of December as well. It's never easy, but that's as we've seen across so many families in Northern Ireland due to COVID, and especially over the additional pressures that we've seen as well. So in regards to staff, and again, I make no apology saying this, what we're now paying the price is that 10 years of underinvestment in our staff. So the 300 additional training places for the 3 years, when those nurses now start to come out of that service, starts to fill some of the gap that unfortunately we inherited at that point in time due to decisions made in the past. So it's not saying everything's going to be fine, but there is a process of getting additional staff into the health service, which will hopefully alleviate some of those pressures that we're currently seeing.
Okay, thank you. Moving on then to Deborah. Go ahead, Deborah, please.
Thank you, Chair, and I just want to wish a happy and healthy new year to yourself, Chair, to Minister Swan, Professor Young and Dr. Michael McBride as well. Thank you for taking the time to come to the committee. I want to pick up on a point there that Professor Young had said in relation to the 25,000 cases per day in terms of the modelling. And I think he said there that was more than the PCR tests that are available. So I just wanted to ask what preparations were made in terms of the modelling, and then in terms of what PCR tests or indeed lateral flow tests would have been available considering that modelling. And I'm not sure if it's something that has been looked at, but, in terms of overall, in terms of the contracts as a UK-wide, can our department go out and get PCR tests ourselves? So the other question I wanted to ask them was looking ahead after Omicron. I suppose if we had a crystal ball, it would be wonderful, but we don't. And I'm just wondering, is there any preparedness or any learning experiences that are going on from Omicron? We don't know. There may be other variants coming down the tracks. So are we looking ahead to, after this particular peak in Omicron, to what might come down the track? And in terms of Omicron itself, are we looking at modelling which may indicate larger hospitalisation rates? And as a result of that, do you think that there is going to be tougher restrictions coming down the track in terms of Omicron and the cases that we have? Thank you.
You're on mute again, Robert. Minister.
Sorry, in regards to the PCR, we're part of the United Kingdom's or the UK contract. Our Barnett consequential for that should be in the region of 16,500, but we get 20,000 per day, and that allows us, we keep a capacity there in regards to our care home testing capacity. That utilises the majority of the available laboratory PCRs across the United Kingdom. To step outside that, we would probably actually lose part of that Barnett consequential rather than gain anything additional. So without the large, I suppose, increase that we've actually seen due to Omicron, that 20,000 capacity per day has stood us in good stead. And I think, as Ian has indicated, in a few weeks' time, we'll be back under that need again, whereas that will actually meet our needs as well. So that's why we've made that temporary change, as I made in my opening comments, in regards to the switch to LFDs as well. In regards to hospital pressures, again, it's something that we continue to monitor. I think we'll have a better idea, and Ian has said this, in the next week to 2 weeks in regards to where hospitalisation is going to take us in regards to Omicron. We continue to monitor ICU capacity and those in need of ventilation, as Ian made in his opening comments as well. Post-Omicron, I'll maybe let Michael or Ian come in further detail in that. But for post-Omicron, will there be another variant? Could it be more severe? Could it be less severe? We're always, I suppose, forward scanning for that, and it's done at the UK Health or UCAS, the UK Health Agency, in regards, and that's why we're part of that as a Four Nations approach, so that they can take that high-level engagement and modelling work in regards, but also the sequencing and the high level of sequencing that we're able to do at a UK level in regards for that searching or keeping an eye for another variant or a new variant. Is it going to be less transmissible? Is it going to be more intense? We do that work across the Four Nations, but I'll maybe let Ian or Michael come in regards to some of those other points. In regards to tougher or further restrictions, the executive met today in regards to where we are, and in regards even to last week's meetings, there's no further restrictions envisaged at this point in time, but I always will caveat that that's where the executive is standing at this moment. Ian or Michael, do you want to come in?
Yeah, just very briefly, and thank you, Deborah, and a very happy new year to you and other members as well. I mean, there will always be new variants of the SARS-CoV-2 virus. There is no post-SARS-CoV-2. This is a virus which is here to stay. What we will increasingly see is a transition from the pandemic phase, which we're living through now, to a stage where this virus is endemic and circulating. It remains to be seen how it will circulate, whether it will have a seasonal picture in terms of, as we see with seasonal flu, for instance, but the virus is here to stay and is going nowhere. What we do know about viruses is that they tend to mutate under selective pressure, and that selective pressure is induced when people have immunity, which is either acquired through previous infection with other variants or as a result of vaccination. So the pressure on viruses is generally pushes them towards becoming more transmissible and escaping from immunity that we have acquired either from previous infection or from vaccination. That's the thing that we need to keep a close and weather eye on. I suppose what we all hope for, but we don't know, is because these mutations occur randomly, is that the virus increasingly mutates to one which is transmissible or more transmissible, but increasingly becomes less virulent and therefore having less of an impact. What I can say is often that progress takes many decades, sometimes centuries. Some of the cold viruses that we have at present, the coronaviruses, have been with us for many years and have taken generations to become less virulent. But the end result is our immune systems will win out in the end, because enough of us will have been exposed to various variants of this virus. Enough of us hopefully will be vaccinated, and ultimately, if there are new variants of concern that escape from either vaccination from the current vaccines or previous infection, then we know that the current vaccines can be modified and put into production fairly quickly. But Ian, you may want to expand upon that.
Just briefly, Ian, please, if you can.
Yeah, no. In fact, I'm content not to add anything. I think Michael summarised very well.
Okay, thank you. Thanks, Deborah. Okay, moving on then to Colin. Go ahead, Colin, please.
Thank you very much indeed, Chair, and Happy New Year to everybody. I hope everybody had a good Christmas break. I just wanted to ask maybe a question about the fact that schools are back this week, and maybe just what sort of impact that there may be from that. Obviously, people are going to be moving about more. There's going to be greater contact between people of different households, and will that have some sort of impact as we move forward into the next few weeks in terms of those figures? And then also maybe just to ask as well about the vaccination and I suppose the rates between those that are vaccinated and unvaccinated. There was some reference to it there, Minister, about those that are in hospital, but can we get some more information about that? Because I feel that it is the greatest case that we can make to people to get out and get vaccinated, is the fact that it is becoming increasingly evident that those that are in hospital and those that are getting the sickest are from the category of unvaccinated, and it's maybe just to get some information on that. And in terms of those vaccinations, is there any suggestion that we may need a further booster in this round of Omicron, given that there's a suggestion that the strength of it may only last around about 10 weeks? Is there any information on that? Thank you.
Thanks, Colin. I'll let maybe Ian or Michael pick up in regards to schools. Look, in regards to the unvaccinated, we actually put out an update from our IAD a couple of weeks ago in regards to the differentials that we're actually seeing. Unvaccinated under 50s are 66% more likely to be inpatients in regards to those who are vaccinated. But the biggest statistic or the biggest comparison that we've actually seen is that for inpatients who are over 50, those unvaccinated are 30 times more likely to be an inpatient than those who have received their 2 doses and their booster dose as well. So that's coming out from our IAD department. Chair, I can get that information shared. It's something we put out from our IAD through our communication channels, but I'll get that shared specifically with the health committee as well, because I think as Colin points out, it is useful information. In regards to the booster doses, again, we take our regular advice from JCVI in regards to where we are in regards to that, so we'll continue to do that. There's nothing currently intimating to me or I've received that would indicate we're going to that point yet. Our focus is still getting people to come forward still for this round of booster doses and their first and second doses as well. In regards to, I suppose, where schools may take us in regards to increasing numbers due to what we've seen in the past when they do return, I'll hand to Ian or Michael for that point.
I'd maybe make a general comment around schools and then very quickly hand over to Ian around the sort of likely impact on terms of case numbers. I mean, it is absolutely inevitable, given the current high levels of community transmission, that with the return of schools that we will see cases and outbreaks within the school environment, particularly given the transmissibility of this variant. What is really important is that there's a doubling down of the baseline mitigations which Northern Ireland Schools, Department of Education, EA have maintained in place throughout the pandemic, and that remains, the regular testing, the testing of children before and teachers before return to school, twice weekly testing, the use of face coverings, and the importance of ventilation. There's no magic one thing that can be put in place in schools other than a continued focus on all of those things that we know that work, and where indeed there are schools where there have been close contacts and outbreaks, that they follow the advice of EA, supported by the expert advice of PHA, and the use of regular testing to maintain as many children and teachers in school as is possible. Ian, just on the modelling.
So prior to Christmas, the largest number of cases were in the under 18s. And once schools broke, we've seen substantial increases, particularly in 18s to 30s, but also all other age bands, with the exception of under 18s, where case numbers with schools off remained relatively stable. So it will be a major surprise if, following the returns of schools, that despite all the mitigations, which undoubtedly help, it would be a major surprise if we don't see substantial numbers of cases in school children. Generally, it will be a relatively mild illness with a small number of exceptions, but the rate of household transmission is very high with Omicron. And once a child becomes infected and is at home, then there's a high risk of transmission to parents and indeed to grandparents or wider members of the family if there's additional mixing. So I've no doubt that the return of schools will produce an upward pressure in terms of cases. And where people are vaccinated, and particularly where they've had the booster in the over 50s, then you may still get the virus, but your chances of getting very severe disease are enormously reduced if you have been vaccinated and had the booster compared to those who haven't been vaccinated.
So just finally, if I might, if there was one thing all members could just support, again, as you have done before, the call to everyone who hasn't yet had their booster to get out over the coming days and get their booster dose as quickly as possible.
Yeah. Thank you. Did you have another brief one, Colin?
No, grand enough for that. Thank you, Chair.
Thank you, Colin. Okay, then, so I'm going next of all to Paula Bradshaw. Go ahead, Paula, please.
Thank you, Chair, and thank you, panel, for the update today. The first question relates to masks in terms of the efficacy of just the standard ones, almost like the fashion ones that people are wearing, as opposed to the medical grade masks, and if the department is going to put out some advice in terms of wearing them properly, making sure that they're washed regularly, etc., just so that they are effective, the ones that people are just buying in the high street. That's my first one. Thank you.
Minister, you're on mute, sorry.
Yeah.
Keep pressing the wrong button here. In regards to efficacy of masks, I think there have been a number of studies in regards to cloth versus medical grade or what grades as well. We would encourage anyone to wear a face covering that's appropriate and at the point of time, because they do work, and it's about getting as many people as possible to wear them as well, and wear them where they're meant to and how they are meant to wear them. It's not below your nose, it's not below your chin, it's actually covering your mouth and your nose as well. We hadn't intended doing any updated messaging, but maybe now that you've asked, we'll consider that in regards to how masks should be worn and when they should be worn as well, in regards to just refresh that in people's minds.
Okay, thank you, Minister. Appreciate that. The second one is in relation to a private members bill that has been introduced in the South in December there on workplace ventilation. I'm not trying to bounce you, Minister, but it's basically about health and safety inspectors going out to workplaces to check the CO2 levels in it, and then to provide advice to the employer in terms of how they can improve the workplace environment. I'm just wondering, is there going to be a similar scheme here in Northern Ireland?
Again, I know you're saying you're not going to bounce me. I'm unaware of that private members bill, Paula.
No, it's quite late on, but I think in terms of just that proactive role for the health and safety executive, for example, to go out.
In regards to ventilation, there was a working group established, again under the auspices of the Executive COVID Task Force, specifically on ventilation I think it was chaired by Peter May, the Permanent Secretary of Justice, who did some work around that as well in regards to the advice and guidance. I can check again, Chair, Polly, I don't have it to hand, but we can share that piece of work and the guidance that was actually published. I think it was published generally at that point in time. In regards for further inspections by the Health and Safety Executive of Northern Ireland, again, not under our remit, but Department of Economy may have input there that I'm not aware of coming out of that piece of work, but definitely we can share that with you, Chair, and with the rest of the committee.
Okay, thank you. Just two short ones then, Minister. First of all, there's the, just before Christmas there, the HRA approved the paediatric formulation of the Pfizer vaccine for 5 to 11-year-olds. I'm just wondering, is there an update on that? And finally, today, 179 confirmed outbreaks in care homes. What support is your department and the Public Health Agency doing to bring that spike back down again? Thank you.
Thanks, Paula. In regards to the paediatric formulation, there's again a UK order in for that. We'll get our Barnett consequential. That delivery is expected initially towards the end of this month, and will be targeted, I think, to those clinically extremely vulnerable 5 to 12-year-olds initially, but also those living with the immunosuppressed as well. So once that delivery of the paediatric formula as actually comes into the UK, we're to get our share of it. In regards to care home outbreaks, again, we continue to give the support that we've given through the number of waves in regards to infection control advice, PPE, regular testing advice, but also the booster vaccination as well. We targeted specifically in regards to our care home sector whenever that advice came out at the start. We're currently undertaking a piece of work in regards to what constitutes a care home breakdown. At this minute in time, it's 2 confirmed cases in either residents or staff. I've asked PHA, and the Chief Medical Officer can come in on this, to actually look as to how, when we are seeing staff, 2 staff testing positive, they may not have been in work, but it's still putting, unfortunately, a care home an outbreak classification. So we're asking that to be currently looked at as well. But the standard advice, guidance and supports that we've always gave care homes, especially during the last number of peaks and outbreaks, is still in place in regards to those. Michael, do you want to maybe come in at that point?
Yeah, just to reassure a member that there's extensive support from the Public Health Agency and indeed from RQIA and trusts, if necessary, to the care home sector, and that in relation to the public health response from PHA and in relation to any staffing problems that are as a consequence of the outbreak. So that work is ongoing. I think in terms of context, it's really important to bear in mind that we have moved on quite considerably from earlier waves of the pandemic, and you're quite correct that while we have 179 open and active outbreaks, and indeed there are about 100 plus inquiries per day into the PHA, and each individual care home has public health consultant input into advising on those outbreaks. 35% of them are asymptomatic, so in other words, been picked up through routine testing. Something in the region of 3/4 of them involve staff members or care partners as opposed to residents. And to date, thankfully, we've had a small number of admissions from care homes, and indeed most of those have not been with severe disease, and that is again a testament to the success of the vaccination program. Early days, no cause for complacency, but I would not wish people to become alarmed at those numbers. There's a lot of hard work going on by care homes providers, by trusts, by the Public Health Agency, and by all staff to keep people in care homes safe. And we've had a very good uptake of vaccine amongst residents and indeed care home workers, which is also helping to keep people safe.
Thank you, Chair.
Yeah, thank you, Paula. Going next to Jerry Carroll. Go ahead, Jerry.
Thanks, and been here a few way, Dave, and happy New Year to yourself, Chair, and everybody, Minister as well. Minister, you mentioned about the underinvestment in staff, and it's something that we've all been talking about, something that I've been emphasising repeatedly. Something that I hear daily, from healthcare workers who feel that there's a lack of investment in services generally, but also in them. And like everybody, I'm very concerned about the state of the health service at the minute, given the pressures with the variant and the ongoing saga with waiting lists. So to that end, Minister, I've raised this before, but I think it's very relevant today and now. People feel that the pay offers and the pay awards that they've been made, that has been offered, is insignificant. Doesn't meet the cost of living, which I've raised before, but inflation is actually increasing further. Further increases in fuel, and healthcare workers are telling me that they're struggling to get by. And that's obviously in and of itself very concerning, but also when we're talking about staff being forced or leaving the health service, it's even more concerning, and it really calls into question how equipped the health service will be and the workers in the period ahead, never mind mental health pressure, stress, and all those things. So my question in relation to that, Minister, is from yourself or the officials. Has there been any assessment or reassessment about the impact of the recent pay offer generally on staff, but specifically around retention and keeping our much needed but are already under pressure healthcare workers in post?
On mute, Minister.
I wish I could say that to him all the time.
Look, you've put him back. You're off again.
So on mute, Minister.
All right.
There you go. That's you.
So you're content with that? No, look, Jerry, apologies. In regards to where we currently are, again, continued conversations and dialogue going on between ourselves and their trade union side as well in regards to if there's additional measures and supports that we can put in above the 3%. As you're aware, the 3% was what was proposed by the independent negotiation body. Again, if I can do more, I'm looking to do more, and our trade union side know that as well. So we continue to have those conversations in regards to, and I suppose it's where we look to actually not just this year's pay award, but future pay awards as well. The current consultations out for the Northern Ireland budget. We have proposals in for what health would like, or what health could look at as well, but that's all part of that wider debate that needs to be had as well in regards to how we recognise those people who actually work in our service. In regards to retention and recruitment, there's a piece of work ongoing specifically amongst our nurses and midwives as well that's been led by, it was the Chief Nursing Officer actually instigated it towards the end of last year, so that work's ongoing, and we should have the initial output from that within the next couple of weeks in regards to what more can be done. Pay is a substantial point of it, but it's also about recognition in other ways, and supports and other measures as well, again, but conscious always of the pressures that people working in our health service are currently under because of COVID, but because of, and there's something that you and I agree on, is the 10 years of underinvestment in the workforce and the health service.
Thanks, Minister. I think just my experience of speaking to people is that they feel that their pay is not being prioritised, and I'm not calling into question your own view on it generally, but they don't see action to increase the pay offer beyond the below inflation issue. And obviously we have the consultative ballots, which close, I think, in a few weeks' time, and we could be facing a situation once again where healthcare workers are on strike, effectively against an offer being made by the executive and by Westminster. But I'll move on, obviously, because time's tight. Paula kindly referenced the a bill being brought by my colleagues in the South about ventilation, and the Minister hasn't seen it, but just on the point generally, Minister or CMO, CSA, do you have any concern? Because I think in terms of implementing and supporting schools to increase ventilation, the funding supplied for it is very limited. Some schools are unable to access proper support or unable to spread out in classrooms. Schools are small. So I, alongside many other people, are very concerned about the ability of schools to be able to ventilate properly as they currently are, but also the lack of investment and support for that. So a view on that. And then finally, work from home. I think there's a lot of work that can be done in terms of enforcing working from home. As I understand it, happy to be corrected. It's a guidance, work from home if you can. But I'm unaware, I'm happy to be corrected, but I'm unaware of efforts being made by the Department of Health, by TEO or whomever, to basically go after employers who are refusing to allow workers to work from home who can. And I think if we do that, and then obviously people can be protected, can be reduce the numbers of people contracting the virus. So any work being done on that would be beneficial to hear from, but I think it's urgent. Thank you.
Thanks, Jerry. And the last part, the work from home is guidance, but as has always been, we've encouraged people to work from home where they can, because as you said, there's restrict those areas of transmission and breaks the chains of transmission as much as possible. So again, it's strong guidance coming from the Department of Health in regards to that and the supports that should be put in place to allow people to work from home where they can in regards to that. As well. In regards to ventilation and the money that's being attributed to schools, I don't want to go there in regards to the amount of supports or financial supports that DE or EA are given to education schools. It wouldn't be right for me to comment on what is another minister's area of responsibility and spend.
Can I just quickly, sorry, Chair, just get the CMO or CSA, just any follow-up on that in terms of safety of schools, with specifically around ventilation? That would be helpful. Thank you.
Well, very briefly then, I mean, just to echo my earlier comments, that there's no one magic bullet that reduces the infections that we're likely to see within the school environment. It's again adhering to all of those basic measures that we've had in place for some time. And obviously ventilation is an important element of that. Again, the issue around ventilation is a very expert area. This has been looked at by the SAGE Scientific Advisory Group on Emergency. That advice has been shared with colleagues at the Department of Education and EA. Air cleaning devices, HEPA filters are no substitution for fresh air ventilation. That's the advice of SAGE, but clearly where indeed fresh air ventilation is limited for whatever reasons in terms of build environment, etc., then they have a place. But fresh air ventilation is that which is recommended by SAGE and firmly recommended by SAGE.
Yeah. Thank you, Jerry. And moving on finally then to Alan. Go ahead, Alan, please.
Sorry, Chair, it looks as though Alan just dropped off. We'll try and get him back on again.
While you're trying that, Jerry, actually, maybe did you want something there from Ian on the ventilation issue as well? I know Michael has addressed it, but Ian, have you anything to add in relation?
Yeah, sure. Yeah.
No, as Michael indicated, the issue of the most effective form of ventilation and its benefits has been looked at quite carefully by SAGE, and all of the relevant advice and papers have been forwarded by us so that colleagues in education are aware of the sort of scientific advice. In addition, as also indicated, the Executive Task Force Adherence Subgroup looked at the issue of ventilation and produced a guidance document which was primarily aimed at business, but was also issued and made publicly available. Fresh air ventilation is undoubtedly the most effective. Now, I think we all fully understand, and having talked to various children myself, this time of year can result in very cold classrooms. But from a perspective of COVID transmission, it is the most effective form of ventilation. Anything else is likely to be less consistently effective or beneficial, and that would include HEPA filters. CO2 monitors are useful tools but don't themselves increase ventilation, although they are helpful in assessing the effectiveness of any other measures which might be in place. I think ventilation is a key mitigation, but as we discussed earlier, given the very high transmissibility of this virus and the fact that children mix not only in classrooms but in other areas of schools, and also travelling to schools together and interacting outside schools, it is going to be, I think, virtually impossible to prevent significant transmission of the virus among children following the return of schools.
And sure, if I can get a quick follow-up if we're waiting on Alan still. Yeah, and Ian or Michael, whoever's best to answer. I mean, I appreciate you maybe not want to get into another minister's portfolio, but I mean, are you both content that everything has been done to keep schools safe? I mean, it is concerning that, Ian, you said that there's going to be a significant number of people getting the virus. It's very worrying and concerning, but are you content that everything possible has been done to make sure schools are safe?
I'm happy to comment, and I'll comment just in very general terms to say that I'm very careful never to say that any environment can be made safe, and I don't think schools differ from any other environment in terms of a highly transmissible virus. You can reduce the risks of being present in a given environment through mitigations, and I'm absolutely content that we have given comprehensive advice to schools and forwarded all relevant SAGE advice in terms of mitigations that can be taken. But even with those mitigations in place, there is still going to be significant transmission. It's not possible to make an environment like a school risk-free in terms of virus transmission with a highly transmissible form of the virus.
I mean, just add to
Yeah, and I see we have Alan back on the line there, so I'll go to Alan now for your question, Alan, please.
Okay, can you hear me, Chairman?
Yes.
Thank you, Chairman. Chairman, we have been concerned today, and we've been hearing about the shortages right across the health and social care family, particularly in the ambulance service. But the reality is that all of industry's been impacted. The police have been impacted, road haulage, public transport. And it's just the reality of the pandemic. There's really no magic wand to cure that one. But in relation to the ambulance service, I wonder, has any consideration been given to the model in the United States of America, where the fire and rescue service can attend to certain types of low-grade ambulance calls, where maybe just advanced first aid is required. So just wonder if any consideration been given to that. The other one is, I've heard people coming to me who have had one or two vaccines and then have contracted the virus, and they have got it into their head that they don't need the booster then. I'm just wondering what the professional response to that is. I know I feel they should certainly be getting it, but I'd like to hear just a professional response to that. In relation to face masks, and I know that the grace period was extended today, and I know that a lot of my colleagues in the retail industry are disappointed with that, because there is still a huge constituency of people out there, for whatever reason, are either refusing or just can't be bothered wearing their masks in public places. And I think it is something that will have to be addressed sooner rather than later. In relation to elective surgery,
I'll have to rush you, Alan, because I'm very conscious we're over time at this point. So if you could just come directly to it, please.
Yes, just two other quick questions. The elective surgery in the Republic of Ireland, I'm just wondering if there's more scope for uptake of that for patients, and does it include an initial consultant consultation? If somebody goes over in the Republic of Ireland, can they recover some of their costs? And just in relation to the COVID task force, all the collective decisions coming out of the Assembly, that particularly the unpopular ones, the fingers do seem to get pointed at the Minister. But we've just heard today about this COVID task force, and I'm wondering maybe if the Minister could expand on what its role is and who actually serves on it. Thank you.
Okay, Minister, and I'm conscious of time, Minister, so if there's any of those items that you want to send information, that's fine, or if you think you can handle them there briefly, go ahead.
Right. Chair, look, prepared to follow up with a written update as to who the Executive COVID Task Force is and who sits on it and its remit as well. It's not something I would have to hand. In regards to the cross-border elective care framework that we've set up, again, I can get how many people, how much and what services are covered, and I could supply that to the committee as well. In regards to, I suppose it's Fire Brigade being able to support NIAS in regards to some of their work. I had a very good conversation with our new Chief Fire Officer and the chair of the board of NIFRS just at the start of December in regards to what more can be done and how conversations could be developed in regards to what more and what additional work the Fire Brigade would be prepared to take on. So that's something we can develop on as well, Chair, at a future discussion as well. In regards to boosters following a first and second dose, I'll ask Michael or Ian to come in very briefly in regards to that one, Chair.
Yeah, well, we know that with each of the variants that's come along, unfortunately, that the level of protection afforded from symptomatic disease has been slightly reduced. But what we do know is that we have good evidence that the level of protection from severe disease, from hospitalization and from death has been relatively maintained at a very high level. So whether you've had a first dose, second dose, the one thing I will say to you, if you're over 50 years of age, and there are 100,000 people or thereabouts in Northern Ireland over 50 who have not yet had their booster vaccination, now is the time to get your booster. You owe it to yourself, you owe it to your family, and you owe it in terms of taking the pressure off our health service. So please don't delay. And if you haven't had your first or second dose, now is the time to get your vaccine.
The question was, but if somebody has contracted the disease, the virus, and recovered after having one or two vaccines, they seem to think, some of them, that they don't need the booster. What is the professional response to that?
Not true. The immunity after natural infection is shorter duration than the immunity after booster. As a matter of fact, the best combination, not that I would wish Omicron or any infection on anyone, we know from the antibody results and cellular immunity, is the people who have had 2 jabs of the vaccine plus natural infection, then their booster have actually very high levels of protection. So please do still get your booster.
Thank you.
Okay, thank you. Okay, listen, I want to thank you, Minister, and your staff for making your top team there for making yourself available on an unscheduled basis at this point in time, given the situation that we're in with COVID. I'm conscious you're under pressure for time right now, so I don't want to hold you back. So I want to wish you and your senior team and all the workforce, the entire workforce of the Health and Social Care Service, a very happy new year, and hopefully we're obviously in the eye of the storm again right now, but hopefully as the year progresses we will see better times ahead, and I would also reiterate your messages there around urging people to please go and get your booster when it's available to you. Please take all the other steps as a minimum to protect yourself and do everything you can over and above the minimum guidance that's out there. Minister, do you want to make any final remarks?
No, Chair, just in regards to that again, thanks for the opportunity to come along to update you and the committee as always. But again, can't re-emphasise what you've just said, what the Chief Medical Officer said, what the Chief Scientific Advisor has also said in regards to the importance and the benefits of people coming forward and getting their vaccinations, should that be first dose, second dose, or boosters. And even at this, critical juncture, every vaccination will make a difference. We know that, so I would encourage everyone to come forward. But as you say, keep following the guidance. It is there, and if you can, just go that little bit further, because that's what keeps us all safe. So, Chair, thanks again for your time, and thanks for your input, and thank the committee for their ongoing support as well.
Oh. Okay, thank you. So I'll let you go there, and then we can close up our meeting then without you. So go ahead, and thank you. All the best. Members, any other comments that members wish to make there in relation to coming out of that session? Carol, go ahead.
So, Chair, I would like, certainly the Minister said that he would provide the details of the meeting with the Royal Colleges that he had on the 14th of December last. So I think it would be, prudent for us just to formally request that. I also think, given the fact that in the department and the trust's own winter surge plans, they needed 500 staff just to stand still. The mathematics aren't adding up. So we have less staff with more pressures and more demand. And I do think we need to drill into the detail. After all, that's our job to scrutinise. So again, I think it would be completely appropriate to invite the Royal Colleges and staff side representatives as a collective to meet with the committee. And then my last point, Chair, is the ambulance service. All parts of the health and social care family are under extreme pressure. But the head of the ambulance service actually said in one of the news bulletins I seen that they have asked families, if possible, to make their own way to hospital. Now, I'm living in, 2 minutes from the city centre in Belfast. That's okay for me. But for families living in rural communities, that's not an option. And I think there is a growing inequality to access to services right across the piece. But particularly when you're ringing an ambulance, that's a life and death situation. So I do think we need to get the figures from the ambulance service in terms of call-outs and how many people that have service, but particularly those that haven't been able to, and a geographical breakdown of that. Thank you, Chair.
Members content with each of those suggestions? Yeah, thank you. Anything, Colin, go ahead.
Yeah, Chair, absolutely agree with what Carol has said there, and of course I'm bound to add on the end of that, that's the rural communities all the time. We have to wait longer for ambulances and are always under that threat of them taking too long to arrive, but it would be important to find that out. Chair, in terms of the questions about lateral flows, I'm glad that there was an answer from the Minister, and I respect that, but at the same time we're hearing from constituents, and we're also hearing from the sectors to say that there seems to be a disconnect between what we're hearing from the department and what we're hearing on the ground. And if we're going to be relying more on lateral flows as a result of the decisions that are taken, I think we need to maybe keep pressing on that. I think we maybe could do with asking about how the distribution is actually taking place, what numbers are actually being distributed in terms of lateral flows on a daily basis. Because just yesterday, pharmacy representative was saying that they got 1 box a day, which was done in an hour. And then we've got officials telling us that there's 1 million that are out there in circulation all the time. And it just seems to be that there's just two completely different connections there. And also, I mean, if you've got a family where somebody actually has a confirmed case and there's 3 or 4 other people in the house that are close contacts, they're required under the guidelines to take a lateral flow every day. If there's a family of 5, that's 50 lateral flows that they require. If you have 7 in a box, that means they need to go into a pharmacy and bring back to them 7 or 8 boxes of these things, not going in and getting 1 box and saying that's 7, that will do you for a week. So I think there is that bit of disconnect that's there that we just need to drill down and be satisfied that the deliveries are taking place and that the demand is being met.
Yeah, so further detail on how that distribution system operates. Colin, is that what you're asking, that we write for further detail on that? Yeah. Members content?
I think, Chair, I think we have to recognise that obviously from a logistical point of view, and I have been asking questions about the test kits, and I have been assured it's not a shortage of kits, that the big problem was just purely over the Christmas holidays, the logistics of getting them out, and we've suddenly been hit with this, as Colin has identified. Now there's more and more demand for them, and I think people are maybe, it's human nature, are hoarding them as well, just to be on the safe side, as it were. But I think that, we really need to wait another few days. I'm not disagreeing with taking the action that Colin's suggesting, but I think that you'll see the situation improve in the next 7 days once things, transport and stuff gets back to normal, hopefully. Thank you.
Well, I think what Colin is suggesting, it will be by the time we get the letter in response to that, it will be a period of time in any case. So I don't think it's really going to tie up too much time to give us an outline on that, to be honest. So I think we'll go ahead. Yeah. Okay, anything else, members? Then I just want to thank members for attending last night. The members that could, a really good session, I have to say, on the adoption bill, and we're doing a further one with the young people tonight. So I just wanted to sort of flag that up to members there. But I thought last night's, and I see Colin and Paul indicating a Pam and O got in for a piece, but had connection difficulties. Really rich information in terms of that adoption bill, I thought. Any comments there briefly from anyone who attended? Paula,
Colin, yeah, thank you so much. I thought it was really, really, really useful. And I suppose it took me about an hour or so to really process the quality of the feed-in. I really supported how candid they were. And I thought your comment was excellent around that you didn't declare you were a social worker, because in our group there was quite a lot of, criticism by individuals, not as a workforce. So I think that there are certainly ways in which we could be strengthening the bill then, just to improve the relationship between the potential adopter parents and those people who would be providing them with the support through the process. So a lot to work on there, and it was great, and I'm looking forward to tonight.
Yeah. And Colin, do you want to say anything in relation to that? I know Deborah's...
Just the only thing, Chair, was that there's a rich amount of information and a great deal of work that's going on, but wondering, and I know we're really tight for time, but I'm wondering, is there a need for us maybe to meet with the chief social worker just about the processes? Because what was highlighted to me last night were maybe things that a bill is not necessarily going to address, but it certainly is highlighting a significant number of problems that there are in the system. And maybe if we were able to provide some sort of feedback to the chief social worker to say, look, we met with people out in the sector and this is what they said, this is what they've identified. Maybe you could take those off and have a wee look at them and come back and tell us other ways to try and address that.
Yeah, well, actually myself and the clerk were thinking that there is some kind of an idea around some sort of event that we could do, possibly after we get, because you're right, it's hard to legislate for some of the things that were being flagged up, but some of them are just pure practice and need addressed in that respect. So we'll keep, there could be some scope there. Pam, I don't want to put you on the spot. I know you had difficulties with connection. Were you able to follow any of it, or do you want to say anything in relation to it?
Yeah, thanks, Chair. No, I did have desperate communication or connection problems, and I got dumped out a couple of times. But I was in for a good section of the first session in a different room, and then when I was able to join back in, it then put me into your room. So I was there for much less time before it dumped me out again. But it was very good. What I heard was very good and very, very useful. I agree with the comments that have been made. So I think it is good to give us a real idea of the real issues that are out there in terms of the processes and the improvements that need to be made. So I think it was very useful to have.
Yeah, and I want, on behalf of the committee, just to thank the engagement team for putting it all together. They clearly had the right people in the room. I think we're going to have a similar quality experience tonight in terms of the session tonight. So I'm looking forward to that myself. So in the meantime, I don't intend to drag this meeting out too long. I appreciate members making time to come in. I know while we're not off work by any means, that there's lots of other things going on at this particular time, and this has been an unscheduled meeting, but I think important in the context of where we're at, and I want to thank you for that. Our next meeting will be on Tuesday, other than our informal meeting tonight. Our next formal meeting will be on Tuesday, the 11th of January at 12:30 p.m. So happy New Year to each and every one of you members and your families on my behalf, and I'll see you then on Tuesday the 11th.